Many men and their loved ones want to know what they can do to decrease the risk from getting an aggressive prostate cancer, but also to improve their overall outcomes if they do wind up with prostate cancer. September is Prostate Cancer Awareness Month. Our guest on the show today is a prostate cancer expert who is a leader in the field when it comes to looking at the role of diet and lifestyle in prostate cancer development and progression. He will get you up to speed today with what you need to know, so stay tuned. The show today is brought to you by our sponsor, the Prostate Health Academy. More and more healthcare consumers are leveraging online resources to not only prepare for appointments, but also validate physician recommendations. With the Prostate Health Academy, you no longer have to spend hours upon hours on Google and YouTube doing your research. The Academy will save you time and quickly get you up to speed with comprehensive and easy-to-navigate lessons that I've prepared for you. We also have an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Again, that is www.prostatehealthacademy.com and click on Join Now. We'll see you on the inside. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Well, I really want to thank our loyal listeners for continuing to follow the Prostate Health Podcast. It is truly an honor to have so many amazing guests, and you continue to embrace them all. Thank you again for being on this journey with me. This will be our last episode of Season 2, and we are bringing back one of our more popular episodes, Episode 60, for an encore today, focusing on the role of diet and lifestyle in prostate cancer development and progression. There will be a brief period of downtime for the podcast before we are back with Season 3. Despite some downtime with the podcast, we'll be keeping busy with some recent exciting news. Our doors are now open with the launch of the Prostate Health Academy. During this downtime with the podcast, we'll be directing our attention to the Academy, spending a lot of time getting to know our new members of the Academy and working hard to help them succeed along their prostate journeys. I'll definitely be keeping our listeners posted when we get closer to opening back up the podcast for Season 3. It is indeed an honor to be able to welcome Dr. Stephen Freedland to the Prostate Health Podcast, who is a true visionary when it comes to looking at the role of lifestyle and diet on prostate cancer. He wears many hats, including but not limited to Director of the Center for Integrated Research in Cancer and Lifestyle, Associate Director of Cedars-Sinai Cancer for Education and Training, Professor in the Division of Urology at the Cedars-Sinai Medical Center in Los Angeles, and a staff physician at the Durham VA Medical Center. His approach toward cancer prevention and awareness focuses on treating the whole patient, not just the disease, by combining traditional Western medicine with complementary holistic interventions. His research interests include the role of diet, lifestyle, and obesity in prostate cancer development and progression, as well as prostate cancer among racial groups and risk stratification for men with prostate cancer. He has published over 600 studies and sits on the editorial board for Cancer Prevention Research, European Urology, International Journal of Urology, and Nature Reviews Urology, among others. He also serves as editor-in-chief for Prostate Cancer and Prostatic Diseases. He completed his urology residency training at UCLA and a fellowship in urologic oncology at Johns Hopkins. Before joining Cedars-Sinai, he was at Duke University as associate professor in the Division of Urology. Dr. Freedland, welcome to the Prostate Health Podcast.
Thanks. It's an honor to be here.
So, Dr. Freedland, is there a link between obesity and prostate cancer?
Absolutely. It's a little complex, but ultimately, particularly relevant for 2021, where, we don't want to find low-grade indolent prostate cancer. What we care about is high-grade aggressive prostate cancer. So the question I would rephrase is there a link between obesity and aggressive prostate cancer? And that is absolutely yes. So unequivocally, obese men are more likely to get aggressive prostate cancer, more likely to progress after surgery, after radiation, after hormonal therapy, and more likely to die from prostate cancer. Where it gets a little bit complex is it looks like obesity, for a few different reasons, may actually be protective for getting low-grade prostate cancer. Now, whether it's kind of a hypogonadal slight state, kind of almost like a finasteride type picture, or you have obese, it's harder to do a good exam, PSAs are diluted because you have more blood volume, you have a bigger prostate, so it's harder to find. I mean, various reasons why we may find fewer low-grade. So if we look at just totality of prostate cancer, it tends to be mostly null. But if we look at aggressive prostate cancer, the cancers we really care about, the answer is unequivocally yes. It is linked with aggressive fatal prostate cancer.
So with knowing that, can men reduce their risk of getting prostate cancer with weight loss?
It's a great question. And that's kind of the next step is, okay, obesity is bad. What do we do about it? And there are some data that weight loss on a population level does decrease the risk, particularly the risk of aggressive prostate cancer. I would say it's not been extensively well studied. And I think part of the challenge is there's not a lot of studies in men who can lose weight and keep it off. I mean, that's unfortunately the reality. And so it's not been extensively studied, but the limited data out there do suggest that weight loss can reduce those risks. And I think it's, trying to draw an analogy from smoking, for example, smoking lung cancer and bladder cancer relevant to the urologist. We know when you stop smoking, your risk goes down, but it doesn't go back down to the risks of non-smokers. It takes time for that effect. And there are some data that the epigenetic effects of obesity don't necessarily go away when you lose weight, but the pro-inflammatory, all the excess cytokines and growth factors, that stuff does go away. So I think if we had enough data, I think we'd see a similar picture that it does reduce the risk. It may not go down to the same risk as someone who's been normal weight their whole life, but I do think there's absolutely benefits to losing weight.
Now, I'm sure you get this question all the time. When it comes to diet and prostate cancer, is there one particular diet that is best for everyone in relation to prostate cancer?
So it's a great question. And I would say in my belief, and we don't have great data, so it's a belief, is no. I think it's, you talk to, people living in Los Angeles. And one of our favorite conversations is, how did you drive here? Did you take this road, this freeway, or I have this back alley road that I take and, this shortcut. And, we all get to the same place at about the same time. Maybe someone saved a minute, maybe someone saved 2 minutes. You got stuck in a red light. So I think it's similar with diet. I don't think there's one true end-all, be-all diet. I do think there's benefits to the plant-based vegan diet. I think there's benefits to a ketogenic diet. I think there's benefits to an Atkins, a Mediterranean diet. You can go down the list. I do think there's increasing data that the Western diet is probably the wrong answer. And the Western diet is really a lot of fat, a lot of carbs, a lot of calories. So if we look at that and probably say that's the wrong answer, it's interesting when you look at the different diets that have been proposed out there, they tend to limit one of those categories. Ideally some calories, but you go to the ketogenic, you're limiting carbohydrates. You go to the vegan plant-based, they're limiting fat. You're kind of making the body work, and tumors don't want to work. They want to have all the nutrients they can get. And so when you can deny them something, you're kind of forcing them to make that, and they don't handle that well. And so that's why I think there are multiple paths to a helpful diet. And it's really, sitting down with the patient and what is it that they can and can't tolerate in terms of their own taste buds and their style of life, and really working with them to find the right path. But I don't think there's one single path.
Well, we're going to take a quick break, then we'll be right back. Healthcare consumers are increasingly leveraging online resources to not only prepare for appointments, but also validate physician recommendations. The problem is that many individuals have no idea where to start when doing their research and waste many hours sifting through the endless sea of information on the web. Not to mention the widespread prevalence on the internet for commercial bias and misinformation. For example, on YouTube, it is reported that 87% of videos on BPH and 77% of videos on prostate cancer contain misinformation. More and more individuals are now turning to the Prostate Health Academy for help. You no longer have to spend hours upon hours doing your research. The Academy will save you time, energy, and quickly get you up to speed with comprehensive and easy to navigate lessons that I've prepared for you. We also have an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Again, that is www.prostatehealthacademy.com and click on Join Now. We will see you on the inside. Is there any association between a high-fat diet and prostate cancer risk?
So, the challenge is if we look back to early data back in the 1980s and 1990s, the answer was yes. We did see associations with high-fat diet. And it seemed to be a little bit stronger for kind of your omega-6 diets, which were your corn oil, more Western-based, not so much your omega-3. But a lot of new studies, including a fair number of meta-analysis now, actually say there's no association. So I think part of it is food is complex. You get into a lot of nuances. So this is one of my favorite things talking with a patient is, I had a patient the other day who's pretty educated about food and nutrition. And so he's like, I'm eating a lot of tomatoes. I'm like, okay, tomatoes are talked about being good. Why are you eating tomatoes? And he said, well, they have a lot of lycopene, but I understand it's not just lycopene, it's other things, in the tomato that, so he was pretty savvy, pretty knowledgeable. And I said, well, how does your body absorb lycopene? He's like, what do you mean? And I said, well, how does lycopene actually get into your body? He's like, I don't know. I'm like, it's fat soluble. So unless you're eating fat at the same time you're eating the tomato, you don't actually absorb the lycopene, let alone all the other phytochemicals. He's like, wow, I never really thought about it. He's like, well, I'm doing a lot of olive oil and stuff when I eat tomatoes. I'm like, okay, that's great. You're doing great. For the person who's having the dry salad with lots of tomatoes because they want their prostate health and want to avoid all the oils, actually isn't absorbing any of the nutrients of the tomato. So it gets really complex when we get into this. And I don't so much, when I think about nutrition and advice, I'd like to be a consensus builder. That's how I view myself. So I talk to the people that are on the plant-based. I talk to the ketogenic, talk to all the different people. And there's only one thing they can actually agree on. And it's not fat. It's not fat. It's amazingly not even calories. You would think that would be pretty non-controversial, but it's not. It's sugar. Simple sugars. That's the one thing. You look at any diet. There's no diet. Maybe the Twinkie diet. That's not really been well adopted into the mainstream. But outside that, there's really no diet that says you should eat more sugar. So that's what I really focus in on my patients. If they want to avoid fat and red meat and things like that, that's perfectly fine. I don't have a problem with that. If they want to eat red meat, I say that's perfectly fine. The ideal diet would be, in my view, is kind of more of a whole foods, that you're eating foods that you can find in nature. And if you're going to eat animals, which is, I think, perfectly fine, they need to be eating their natural diets. So, wild caught fish, free range chickens, grass-fed beef, that type of stuff. But in terms of fat, I'm sure there will be people out there who disagree with me, and I'm happy to have that debate, in the literature, looking at meta-analysis. I'm pretty unconvinced that just the amount of fat or even the makeup of the fat plays a major role.
And now you mentioned sugar. Certainly a hot topic lately has been the association of sugar and cancer. What do we know at this point regarding links to sugar and prostate cancer?
So there's a lot of reasons to point the finger at sugar. And the reasons are biological reasons, intuitive reasons, animal data. The human data have not been as convincing, I have to admit. We certainly know if you eat sugar, your body makes insulin. That's a normal physiological response to eating sugar. We know if you take prostate cancer cells in a petri dish and you add insulin and you add sugar, they're going to grow faster. We know that. You take an animal, a mouse, you inject it with a human tumor cell, and you feed it more sugar or less sugar, tumors grow slower. So we know that. So there's a lot of reasons to think that sugar would be the enemy, so to speak. When we look actually in the epidemiological literature, though, observational data, we don't necessarily see strong associations. And I think part of it is we don't have a lot of people naturally living super low sugar diets. We do see associations with kind of a Mediterranean diet and reduced prostate cancer risk and mortality. And that has some of the same elements in it. we've actually conducted now 3, we're in the middle of the 3rd, but 2 published trials of extreme low carbohydrate diets for men with prostate cancer. One for men starting ADT, where we saw decreased risk of insulin resistance, decreased fat gain, we saw significant weight loss. So a lot of metabolic benefits. And the second was actually men with recurrent prostate cancer. So kind of your BCR, biochemical recurrent state. And the study was going great. And unfortunately for us, good for patients, Aximum came along and everyone got imaging and we found all these METs. And so we were trying to treat non-metastatic recurrence. So we had to stop the study early. But we did see that we could actually slow, in the secondary analysis, the primary analysis showed no difference. Suggestion of slowed PSA growth, PSA doubling time, about a 7-month delay in doubling time. It was a small study, and we actually adjusted for baseline differences. It was actually over a year that we extended doubling time. The men lost, 20, 22 pounds in the study. So is it the weight loss? Is it the low sugar? Can't easily tease out. It looked to us in some analysis that was more related to the sugar, but when you're losing 22 pounds, you're doing a lot of benefits for the body. So it's hard to say.
So what is would you say the biggest problem or challenge for patients with diet?
I think, it's a great thing. I don't get the sense it's a knowledge. Some patients just don't know what to do. I think most patients know what to do. It's just hard to follow. I mean, we spent a year in quarantine. There's stress, there's anxiety. I mean, I look at myself and I'd like to think I know exactly what to do. And it's my birthday a few days ago and there's a cake and it's sitting out there in front of me and I'm great during the day and I'm doing everything right. And then dinner, I'm staring, at the cake and I'm just like, gotta have a piece, maybe 2, it's just, I think that's the hardest part. And so the advice I give to patients when we really get into it is just eliminate the temptations. Yeah. Just don't buy it. Don't have it in the house. Don't have it available. Don't think you're going to have the willpower to overcome that. Just don't have it in front of you. Yeah. Don't go shopping when you're hungry. That's notorious. You go grocery shopping and everything looks good, especially the candies at that point, and really try to cut out, the simple sugars, the cookies, the cakes, the candies, the sodas, and just don't have it in front of you is the easiest way. And then, plan, be prepared, and know you're going to get hungry at 4:00 in the afternoon. It's a long day. It's 4 hours after lunch. You're just going to start to get hungry. What are you going to eat? Are you going to run to the pantry and get a cookie? Or are you going to have some vegetables cut up ready that you can do? And know the vegetables may sound good, but you don't like them. So you got to pick things you like and really kind of mentally prepare for the meals throughout the day. And I guess the final advice I would say with patients is, we all want to eat perfect, but the reality is we should eat better. It's not always making the perfect choice, it's making the better choice. So an example, I was talking with a patient once and he asked, is it okay to eat some whole wheat crackers? And and he was trying to be kind of low carbish. And so we were talking about that. And I said, well, if you didn't eat the whole wheat crackers for your snack, what would you eat instead? Thinking he might say, well, I might have some, broccoli or something like that. He's like, if I didn't eat that, I would eat Oreos. I said, have the crackers, please. By all means, have the whole wheat crackers. Yeah. So again, is that the perfect choice? Maybe, maybe not. I don't know. Depends on your view. But certainly Oreos was the wrong answer. So it's working with patients and trying to get them to eat better.
I appreciate your kind of final thoughts in regards to diet. What about any concluding thoughts regarding what you tell your patients in terms of recommendations for exercise for a healthy prostate?
Yeah, no. So exercise, to me, it's like the peanut butter and jelly. It goes together. You get diet and exercise. Let me come back to that in 1 minute. Other things, that I do talk about is trying to get a good night's sleep. I think sleep deprivation is a major issue and that actually leads to less resiliency, making worse food choices. So I think getting a good night's sleep, we actually go over sleep habits with patients, trying to avoid anxiety and stress. Easier said than done. It's a very 24/7 world. COVID, politics, everything going on. It's a stressful time for a lot of people. And so try to work on that. But in terms of exercise, I think it's more is better is one simple message. The other thing is the data really, in terms of prostate, are more and more suggesting that it needs to be vigorous exercise. So the gentle walk you may take with your partner in the evening and talk about your day and reflect on things, that's great. That's connected time. That's wonderful. You are getting some physical activity. That's wonderful. But you really want the exercise that gets your heart rate going. And, someone said, once, they're allergic to exercise because every time they exercise, their heart rate goes up, they get short of breath and they get flushed. It's an allergic reaction. But in all seriousness, that's kind of what you want. You want the exercise where your heart's going. You need to make sure and check with your doctor if you have heart conditions and other things that it's safe. But you do want that kind of pushing yourself type exercise, kind of vigorous. And, some people say, what's the definition of vigorous? My point is, if your heart rate's up, you're a little short of breath and you cannot hold a conversation, that's vigorous. Different for every patient. There is no, you have to walk X miles per hour or lift so much weights or whatever. It's just, if you can get to that point, that's vigorous.
Well, I know I get a lot of questions in regards to supplements and what data is available in regards to prostate cancer. I know we are running out of time here today on the podcast, but Dr. Freedland will be sticking around here for a few extra minutes for some bonus discussion on the topic of supplements in prostate cancer. For those that are interested, we will be including this discussion inside the Prostate Health Academy. We still aim to open this yet in 2021, so for those that are interested, make sure you don't miss it and can sign up to be included on our list at www.prostatehealthacademy.com. So Dr. Freedland, any final thoughts for our listeners today?
Yeah, I would say, it's a cliche, but to me, it's, genes load the gun, but lifestyle pulls the trigger. So you may have bad genes. You can blame your parents, but there's not a lot you can do about it. In that sense, you have those genes. But on the other hand, there is stuff you can do, and lifestyle modifications and trying to maintain a healthy weight, get your exercise. If you're not a healthy weight, get down to that weight, maintain it. And again, continue to eat and live better. It's not perfect, but better. That's the goal.
Well, it was an absolute pleasure getting to chat with you today. You've really provided valuable information, which will serve our audience well and empowering them along their prostate journeys. So thank you again for chatting with us today on the podcast.
Thanks so much for having me.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/prostate health podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.